There is a tree that holds the answer to the greatest medical crisis of our time. For 4,500 years, it cured what antibiotics cannot. Every part of it, bark, leaves, seeds, roots, fights bacteria, viruses, fungi, and parasites simultaneously. It kills the drug-resistant superbugs that are sending patients to die in isolation wards. One tree provides more medicines than an entire pharmacy. Then, in 1994, a corporation and the United States government tried to own it. They filed a patent claiming they invented what Indian villages had known for 45 centuries. The tree that belonged to no one would finally belong to someone. But the tree does not surrender easily. This is the story of Neem, the village pharmacy that defeated an empire, the living antibiotic factory they could not control, and the answer waiting in plain sight while pharmaceutical companies charge $500 for what grows free. The archive opens in Munich, Germany, March 8, 2005. The European Patent Office stands before a decision that will echo across continents. Patent EP 0436257, filed by the chemical giant W.R. Grace and the United States Department of Agriculture. The claim? Exclusive rights to a fungicidal method extracted from the neem tree. Standing in opposition are 3 women who refused to let ancient knowledge become corporate property. Dr. Vandana Shiva from India, Magda Aelvoet from the European Parliament, Linda Bullard from the International Federation of Organic Agriculture Movements. They brought evidence, not lab reports from the 1990s, but Sanskrit texts from 1500 years before Christ was born. Palm leaf manuscripts showing extraction methods perfected when Rome was still a village. Testimonies from Indian farmers whose ancestors used neem to protect crops for 100 generations. The corporation argued that their extraction method was novel, that because they purified the compound in a modern lab, they had invented it. The Patent Office looked at the ancient texts. After 10 years of legal battles, they ruled. Patent revoked. The reason stated in official documents was lack of novelty. This knowledge was not new. It had never been hidden. It was written in the soil of India for 45 centuries. W.R. Grace had tried to patent the sun and lost. But to understand why they wanted to own it, you have to understand what this tree can do. Rewind 4,000 years to the Indus Valley. A tree grows along the riversides. Its branches spread 80 feet wide. Its roots dive deep into earth that kills lesser plants. The people call it Nimba, the bestower of good health. The Persians call it Azadirachta, the free tree of India. Free because it belongs to everyone and no one. Every morning, villagers snap twigs from the tree and chew the ends into brushes. Their teeth stay strong. Their gums do not bleed. Infections that kill others never take root. When smallpox sweeps through villages, they hang neem branches above doorways. The air itself becomes medicine. When locusts arrive in clouds that darken the sun, they devour every crop in sight. Wheat, rice, vegetables turned to dust. But the neem trees stand untouched. The insects starve rather than eat the leaves. By 1500 BC, the Karaka Samhita, the foundational text of Ayurveda, lists neem as Sarva Roga Nivarini, the universal healer of all ailments. This was not superstition. It was observation refined across centuries, recorded in texts that would outlast empires. The tree protected villages for 4,000 years. Then the world decided it needed proof. In the 1920s, a German entomologist working in Sudan watched locusts destroy every plant in sight. Corn, sorghum, cassava, everything, except one. The neem tree. He isolated the compound responsible, Azadirachta, a molecule so complex it took chemists another 50 years just to map its structure. It disrupts insect hormones, stops them from feeding, prevents them from reproducing. But the tree does not just stop insects, it stops us from dying. Here is the secret the pharmaceutical industry hates. A modern antibiotic is a single molecule: penicillin, tetracycline, amoxicillin. One compound attacking bacteria through one specific pathway. Because it is a single attack, bacteria can figure it out. They mutate, they evolve, they adapt. They become resistant. Neem is different. Neem is not one molecule. It is 300. Azadirachta, nimbin, yadunin, quercetin. 300 bioactive compounds working simultaneously, each attacking through a different pathway. When you use neem, you are not hitting bacteria with a sniper rifle. You are hitting it with an army. Some compounds shatter the cell wall. Others strangle protein synthesis. Others scramble DNA replication. Others dissolve the biofilms, the protective shields bacteria build to hide from antibiotics. Bacteria cannot mutate fast enough to defend against 300 simultaneous attacks. Evolution needs predictable pressure, a single threat to adapt against. Neem provides chaos. In 2022, researchers confirmed what villagers knew for millennia. Neem leaf extract kills MRSA, the methicillin-resistant superbug that turns simple cuts into death sentences in modern hospitals, at concentrations as low as 4 milligrams per milliliter. It destroys drug-resistant Escherichia coli and Salmonella, and the parasites that cause malaria. And it does this without creating resistance. 4,500 years of use. No adaptation, no immunity. The bacteria never learned. So why is it not in your pharmacy? Why, when the CDC warns we are entering a post-antibiotic era? When doctors watch patients die from infections that should be trivial? Are we not planting this tree on every corner? The answer is simple and brutal. You cannot patent a plant. Pharmaceutical companies need 20 years of patent protection to justify the $2 billion it costs to develop a new drug. They need exclusivity. They need a monopoly. Neem offers none of that. It grows wild. Anyone can plant a seed. Anyone can harvest the leaves. Anyone can brew the tea. There is no profit margin in a cure that grows in your backyard. So the suppression happens not through fire or force, but through paperwork. In the United States, the FDA classifies neem as a dietary supplement or cosmetic. That means a company can sell it, but they cannot tell you what it does. If you bottle neem capsules, you cannot claim it cures infection on the label. You can only say it supports immune health. Vague, meaningless. Ignored by every doctor trained to prescribe only FDA-approved drugs. To make a medical claim, to say this kills MRSA, you need FDA drug approval. That requires Phase 1, Phase 2, and Phase 3 clinical trials costing a minimum of $500 million. No company will spend $500 million testing a tree that their competitor can sell for $10 the day after approval. The economics are impossible by design, so neem remains in legal limbo, proven by history, confirmed by science, exiled by a system that confuses profit with progress. Meanwhile, the crisis accelerates. The last new class of antibiotics was discovered in 1987. Nothing fundamentally new in nearly 40 years. The pipeline is not just dry, it is abandoned. Bacteria are winning. The CDC reports 2.8 million antibiotic-resistant infections every year in the United States alone. 35,000 people die, not from the infection itself, but from our inability to treat it. Infections that penicillin cured in 1950 now require drugs so toxic they destroy kidneys. We are treating pneumonia with medications that feel like chemotherapy because the gentle drugs no longer work. Doctors call these last resort antibiotics. But what happens when the last resort fails? The answer is already appearing in hospitals. Patients placed in isolation, infections spreading through surgical wards, bacteria that laugh at every drug we throw at them. And yet, the solution exists. A study in 2021 confirmed that when you combine neem extract with failing antibiotics, the drugs become powerful again. The neem does not cure alone. It weakens the bacteria's defenses. It strips away the biofilm. It opens the door so the old drugs can finish the job. It is the bridge between what worked and what we need next. But we are not crossing it. Instead, we have a system that prioritizes novelty over efficacy, patents over patients, control over cure. A system that would rather invent a synthetic molecule that fails in 5 years than admit a tree has been doing this work for 5,000 years. But the tree does not care about our systems. It grows in India, where 18 million trees line the streets of villages and cities. It grows in sub-Saharan Africa, where its roots hold back the Sahara Desert. It grows in South America, Southeast Asia, Australia. The United Nations called it the tree of the 21st century in 1992. 34 years later, we still have not listened. Every tree is a factory producing 300 medicines simultaneously. Every seed contains the genetic code to defeat superbugs. Every village with a neem tree has a pharmacy that never closes, never runs out of stock, never demands payment. The bio-piracy battle of 2005 proved something critical. The law can stop a corporation from owning the tree, but it cannot force the system to use it. The knowledge survives not in research journals or hospital formularies, but in practice, in the hands of grandmothers who still crush the leaves into paste for infected wounds, in the farmers who still spray neem oil to save their crops without poison, in the villages where a single tree protects an entire community from diseases that send city dwellers to emergency rooms. When the antibiotics finally fail completely, when the superbugs overwhelm the last chemical defenses we have built, when hospitals become places people fear to enter, the neem tree will still be there, growing in the heat, producing its 300 compounds, waiting for us to remember what we pretended to forget. Not because it was rediscovered by science, because it never left. Because you cannot kill knowledge that lives in the soil. The answer was never lost, just ignored by those who needed ownership more than they needed a cure. If this vault opened something for you, subscribe to Nature's Lost Vault and hit the bell. Every like and every share preserves what they tried to erase. The next vault opens soon,